Thanks for coming tonight. So just to kind of piggyback off of what Bruce had talked about, as a family member in recovery myself and having gone through this process throughout as far back as I can really remember, there's all the questions that come up. How do I know? What are some of the signs or symptoms I can look for, not just for an overdose like Bruce had talked about, but how could I maybe pick up on the fact that my loved one is using substances or struggling with a substance use disorder? So we're going to talk about signs and symptoms. If you have a handout, it's the first page. I broke it down into 3 different categories. So emotional, physical, and behavioral, and we'll start with emotional. And I just want to point out that as we go through some of the signs and symptoms, these are only indicators. So just because we pick up on some of these things doesn't necessarily guarantee that someone that we love and care about is using substances. We want to look for patterns and consistency. So are we seeing these things over and over again? Are they happening longer and longer? And then that's something that's a red flag that we want to maybe look a little bit more in depth with. So if we talk about emotional signs and symptoms and we think about how do personalities get affected when someone is using substances? So a lot of times, right, the person that we care about, their personality changes. So character traits that are there normally usually tend to change. So we talk about aggression or irritability, someone having a short fuse. If I'm using substances, generally I'm using those as a means to cope. So if I'm using a substance or drinking alcohol as a means to cope, I'm not dealing with my emotions in a healthy way. So I'm not utilizing healthy coping skills. So the aggression is very common to see. The short fuse, of course, because I'm internalizing all of the things that I'm dealing with and I'm not ready to be at that point where I say, hey, I'm seeing what you're seeing, let's take care of this. So a lot of times these are things that we see pre-contemplative stage, a lot of denial, things like that. So aggression, short fuse, if you notice someone, little things that normally wouldn't set somebody off are starting to set them off. Maybe they're coming home and they're really on edge, restless, you're asking them a question and they're snapping back. A lot of times if we're confronting the things that we're seeing or hearing and picking up on and they're not ready to accept it or admit it or see what you see, we get the pushback. So a lot of times we see the defense mechanisms. Minimization is huge. So you're overreacting. It always gets deflected back, right? So you're crazy, I don't know what you're talking about. That's not true, I'm just having a bad day, or I'm just really tired, leave me alone. I might as well go and get high if you're constantly accusing me of getting high, right? So the minimization. Nothing's wrong, nothing's happening. Again, that denial piece. We think about rationalization and justification and how easy it is to justify something. So, I had a really crappy day at work, I deserve a drink, or maybe I had a really great day and I deserve to celebrate. So always finding a reason to justify the behavior. Loss of interest in activities or people or places, things that we once enjoyed. So a lot of times if the primary focus is the substance use, and if the use is progressing especially, so things that once I had an interest in, so going to my kids' soccer games, attending dance recitals, basketball, baseball, concerts, spending time with family or friends, and now you're noticing over time, I'm canceling, I'm not going, and it's out of character, right? Because those are things that I usually like to do. Anxiety, depression. So we'll talk a little bit more about dual diagnosis and co-occurring in a little bit, but a lot of times we see an increase in mental health issues as well. So anxiety, right? So if I'm internalizing all of these different things that I'm dealing with and I'm not talking about them and I'm not coping with them in a way that's healthy, what's happening? They're manifesting. So of course I have an increase in my anxiety. Depending on what type of substances someone is using, there could also be an increase in anxiety. So stimulants or amphetamines, things like that, that might increase paranoia, obsessions. If I'm using something that's causing hallucinations, maybe I'm up for 3 days so I'm not sleeping, so hallucinations and things like that are very common. Racing thoughts, the obsessions, again, depending on the use of substances. But to see those things happen, because I'm dealing with all of these things internally. So I'm not talking about them. I'm not communicating what I'm feeling. So they have to find a way out. Usually that can come with anxiety. Anxiety, I think, goes hand in hand with depression. One kind of feeds into the other. So if I'm internalizing all of these things, now maybe I'm staying home more so than normal. I'm becoming more of a homebody. Maybe I'm sleeping 3 days in a row, I'm not getting out of bed, no energy, no motivation, things like that. Again, depending on the substances, that could cause a lot of those signs and symptoms, but it could just be not dealing with the emotions that I'm feeling. So that could contribute or feed into depression. And a lot of times, if those things are already present, anxiety, depression, bipolar disorder, mood disorders, things like that, ADHD, if I'm not treating those in a healthy way, or if I'm not taking the medications to manage my regular symptoms that I deal with on a daily basis, those symptoms can become worse, or different disorders can also develop. So if we switch over and talk about physical signs and symptoms, Bruce had talked about pupils. A lot of times that's a big indicator of substance use. So like he had talked about the pinpoint pupils with opiates, stimulants like amphetamines, cocaine, methamphetamine, things like that, you'll see dilated pupils. So large and black. And again, they're not changing depending on the lighting of the room. Repetitive or slurred speech. So again, if someone is drinking, a lot of times the speech becomes slurred. If I'm going into an overdose, my speech can become slurred as well. So those are things that you want to pick up on. If someone is using stimulants, you're more likely to see an increase like rapid speech, rapid heart rate, things like that. Sniffing or runny nose, and I say that's not attributed to just a common cold, because just because someone is sniffing or, blowing their nose, constantly sneezing, doesn't necessarily mean that they're using substances. But again, we want to look for patterns. So we want to be able to rule out any type of medical or health condition that could also be present as well. If someone is snorting a substance, whether that be a powder substance or crushing up a pill, that could cause sneezing, runny nose, things like that. Paler skin discoloration, one of the things that we know about using substances, if the focus is on the substance use, I'm probably not spending a lot of time taking care of myself, so my hygiene is lacking. So that could be what I'm eating. Maybe I'm not eating enough. Maybe I'm overeating. So you could see that skin discoloration as well. To piggyback off of that, weight gain or weight loss, again, depending on the use of substances, can cause a decrease in appetite or an increase in appetite. Restlessness, chills, sweats, nodding off. Bruce talked a lot about those things as well as indicators of an overdose, which can also be, but may not be as well. If we talk about behavioral, so if we take the emotional and we take the physical, usually then over time we start to see the behavioral things start to happen. So calling off from work, coming up with excuses why I don't have to go into work. If we're talking about children or school age or maybe college, not going to class, skipping class, again, coming up with different excuses as to why I can't go or why I haven't been going and I don't want to go anymore. Isolative behavior, so I think this can go either way. So a lot of times we could see, someone becoming more of a homebody, staying home, not socializing, but sometimes we can tend to see the opposite as well. So if I'm someone who tends to be more someone who deals with social anxiety, I struggle with social settings, communicating with other people. If I find that the more I drink, the more social I become, the less anxious I am around people. So of course I want to latch on to that feeling. So now I'm drinking more and now I'm going out more, socializing more. So again, depending on the substance, again, you see, both ends of the spectrum there. Disrupted sleep patterns, we talked about that before. Legal consequences, so now I have a DUI, maybe I have a possession or paraphernalia charge, and now I'm dealing with the law. Engaging in high-risk behaviors. So the use of substances are used as a means to cope, right? So if I'm not coping with things in the way that I should, a lot of times my priorities fall down the ladder. So maybe I'm spending so much money on obtaining the substances that now I'm not paying the bills. Well, my bills have to get paid, so maybe I'm stealing. Or maybe I'm running out of money and maybe I'm stealing because I need to get more substances or drink more, whatever the case might be. Stealing, promiscuity, gambling is another common one as well. Financial consequences, we talked about that. Changes in attitude or personality, chronic careless mistakes. And again, this could be something where maybe I'm going to work every day, still showing up and I'm there physically, but maybe mentally I'm checked out. Mentally I'm somewhere else. And that could happen at home as well. So again, we want to look for patterns. So if you flip the page, it talks a little bit about comorbidity. So the presence of one or more disorders within the same individual. So if I'm someone who already has anxiety, or maybe I already deal with depression, and I'm finding that, the use of substances, self-medicating, is helping treat my symptoms. So now I'm latching on, and that becomes my medication, right? So I'm going to continue to contribute to the symptoms that are already there. This is kind of one of those things like what comes first, the chicken or the egg. And if you can't tell, or if, you don't know that anxiety or depression or bipolar disorder or something like that is present prior to the use of any substances, over time, the effect of using substances can cause the development of anxiety, depression, things like that. So if someone enters into sobriety, and I think the average recommendation is 6 months into sobriety to get reevaluated, because some of those symptoms of anxiety or depression or things like that, they might start to subside. So maybe the anxiety that was there during active addiction, now you're sober, coping with things in a healthy way, you have a positive support system, so maybe those symptoms subsided, they're no longer there. We talk about risk factors. So, as family members, I know for myself, I often ask, how did we end up here? How did this happen? I can't really figure it out. There's a lot of risk factors. And is it one thing that causes it? No. Can it be a combination of all the above? Probably, right? So the genetic component, genetics are something that we can't change. We're given our genes and that's it. Can't change them. But things we can know can run in the family. So things can be hereditary, heart disease, addiction, things like that. If we know that that runs in the family, we know that we're at higher risk to develop a substance use disorder. If alcoholism runs in my family, well, maybe it's something that I won't have to deal with, but maybe it will. But it's good to know that, because if the awareness is there, then we can look for those signs and symptoms and we can treat them. Trauma. Trauma is a huge factor. What we know about trauma is unhealed wounds or unhealed trauma that manifests. It doesn't just go away. We can't just really block things out. The analogy I use is it's kind of like a laundry pile. If you don't fold it and you just keep pushing things to the side, well, that pile gets bigger and bigger, right? Eventually it topples over. The same thing happens with trauma. If I don't learn how to deal with or cope with the trauma that I've maybe experienced at some point in my life, there could be a long-term effect to that. Is anyone familiar with the ACE study? So it stands for Adverse Childhood Experience, and it was a study that they did in Southern California. I think it was 1995 to 1997. What they looked at were 17,000 adult participants, and they looked at the correlation or the relationship between their current physical health as adults and their childhood experiences. They looked at things like physical abuse, mental abuse, sexual abuse, physical neglect, emotional neglect, someone in the home struggling with a mental health disorder, someone in the home struggling with substance use disorder, divorced parents, mother treated poorly, an incarcerated relative. I think those are the 10. What they found was out of 17,000 participants, 64% experienced at least one of those things at some point in their childhood. What we know about the first 3 years of our life, that's when our brain develops. That's when we can start to recognize emotions, basic emotions, but that's when we start to recognize those, and that's when we learn the nature and nurture component too, as our ability to start coping with those emotions, right? So when that process gets disrupted, if I don't treat that again, or if I stay in that same toxic negative environment, that can cause long-term effects later on in life. Not only high-risk behaviors like the ones we talked about before, the development of a substance use disorder, maybe struggling with some kind of mental health disorder as well, but also the physical side of things. So what do we know about chronic stress? Is it kind of works its way from the inside out, right? That takes its toll on us physically over time. So what happens with that? High blood pressure, if I'm not watching what I'm eating, diabetes, obesity, eating disorders. So it not only puts us at higher risk for substance use disorder, but a lot of other things as well. So it's important to pick up on the things that are happening in our lives and the lives of our loved ones and make sure that we're treating those things. When we talk about treating those things, we talk about environment. Environment is also a huge factor. If I'm growing up in a home that's dysfunctional, maybe there's a lot of chaos, if I don't know anything else, that becomes my norm. As we get older, we model what we know, right? Or what was done around us. If I'm not shown otherwise, that's how I know as my environment should be. So I'm likely to continue those same behaviors. If substance abuse is something that's present in my home growing up, in yelling or screaming or abuse, I'm likely to continue those same behaviors. If we have a healthy environment, if we have a positive support network, it makes a big difference. If I'm shown that what I'm dealing with at home is unhealthy, but I'm shown that there is a healthy dynamic that I can have, I know the difference. Knowing the difference, I could start to take my current environment and change it into a healthier environment. That's better for me, and if I have that positive support network, that's better for all of us, right? Addiction is a family disease. It doesn't just take the effort of the person who's struggling with the substance use disorder. We're all involved. We all require footwork, especially if we want better long-term recovery. We have to recover ourselves. So our environment has to be just as healthy. So we talk about different family roles, and these are common. There's 6 of them. You may be able to connect with or relate to maybe one, maybe none, maybe a couple different ones, right? So the addicted, the person struggling with the substance use disorder. The enabler. I know at some point I think I've played almost all of these roles, and at some point in my life, a lot of times the enabler is contributing to the use of substances. I know there were a lot of times where I thought I was helping, and I wasn't helping, I was enabling. I'll give you an example. So right before my daughter was born, her dad came home from jail, and at that point I thought, okay, well, the easier I make his transition home, the more likely he is to focus on his recovery. So I took care of everything financially, clothes, anything he needed I got, car insurance, all that stuff, looked for job applications, filled them out. What I didn't realize I was doing was taking away any accountability or responsibility, and that wasn't healthy for him. I thought I was helping, but I really wasn't. My intentions were good, and a lot of times our intentions are good because they come out of care and concern. But I had to look at what I was doing and how I was contributing to the addiction. Not directly, but indirectly. So sometimes enabling are things that we know that we're doing, but sometimes they're things that we don't know that we're doing. And if we have, again, that positive support network, if we can't hold ourselves accountable, because it's not always easy, we have other people that could say, hey, do you know what you're doing? Are you seeing what's happening? And they could help hold us accountable when we can't hold ourselves accountable. The hero, so the person who takes on all the pressure. I'll take on all the problems, it'll be okay, we'll be fine. Kind of like the backbone of the family. Again, great intentions, but what happens there is that they take on all of this pressure. Chances are they're not taking care of themselves because they're not setting healthy boundaries. Eventually that takes its toll too because they're not dealing with their own emotions and handling them in a healthy way. The scapegoat. So what we know about a home dynamic or a family dynamic, or even just in general, okay, so addiction aside, you have a really long day at work, really stressful day, you come home and someone says, what's for dinner? If I haven't processed through that stress yet, what happens? I might explode, right? Snap out, short fuse, not intentionally, I don't mean to, totally unrelated to what they had asked me, but they're the scapegoat. They just happen to be in the wrong place at the wrong time, and that's my outlet. Because our feelings don't just go away. We can't block them out, like I said before. They have to come out. So if we don't handle them in a healthy way, they usually come out in a way that we maybe regret, feel some guilt and shame, and it's a way that we don't want them to come out. The mascot. So what do we know about humor? It's very easy to use humor as a means to cope, as a way to deflect from the seriousness or the reality of what's happening. You know, a lot of times to deal with something that's very deep or heavy or brings up a lot of negative emotions or just emotions in general, sometimes we don't know how to handle those things. So people turn to humor because it makes light of the situation. And then it kind of distracts me so I don't have to deal with it. The lost child. So they say this is really common to be the youngest child, but I really think it could be anyone in the home. So if I'm focusing so much attention on the person who's struggling with the substance use disorder, if I have kids in the home or if I have other family members in the home, they're definitely not getting the attention that they should. So a lot of times they become more passive and they could start to act out as well. So that could affect not just the substance use disorder that we're dealing with in the home, but then that can cause additional issues that now we have to deal with as well. So again, these are just general things. They're not something like, oh, well, I don't see those things happening in my home. Maybe you don't, and that's okay. But these are things that we can run into or can see in the family dynamic. So when we talk about all of these things, signs and symptoms, what if I'm seeing these things? What if I'm hearing these things? What if these things are happening in our home or friend's home or someone that we know, or it's happening at work? Well, what do we do? What don't I do? You know, and these are just suggestions. This isn't like something that you have to hang up at home and follow verbatim, you know? So don't look down or judge the individual. And I think at some point I've been guilty, at least myself, for all of these things, because a lot of times our emotions, if we're not dealing with them, they come out as anger. If we're talking about someone that we love and care about, and we're trying to express our concerns, and they're not seeing what we're seeing, it hurts. It causes frustration because we care. But anger isn't the way to access it. Does it happen? Yeah, of course it does, because nobody's perfect. But what we're doing by judging or saying derogatory names or stereotyping, things like that, all we're doing is contributing to someone's negative self-thoughts that they already have. We're not healing anything. We're not fixing anything. We're really just making things worse. And for ourselves too, because we're not resolving anything. Ignore the problem, force them to quit. If we ignore it, we can't treat it. If we don't bring awareness to something, there's no way we could deal with it because we're not talking about it. Communication is key in everything. Forcing someone to quit, we could plant the seed and give the recommendation or give a suggestion or say, hey, when you're ready, let's talk about this. Or hey, when you're ready, I have this list of resources. Maybe we could just look through and see if you're interested. Maybe they won't be ready. Maybe 2 weeks later, 2 hours later, maybe 6 months down the road, they'll come and say, hey, remember you said that you had that list? Let's look at it. But if we force it and someone's not ready, sometimes we just push them further and further away, and that's not what we want to do either. Expect immediate results or cure. Recovery is a process. It's a process for them, it's a process for us, and it's constantly ongoing. It's not something, you don't go away for 28 days and come home cured. Process. It's a journey. Assume the loved one is the only one who needs to work on their recovery. I said that and I'll say it again and again. We all have to put in the footwork for ourselves, for them, because that's what makes for a healthy family dynamic. Blame or criticize, use derogatory terms. We've talked about those. What can we do? We can educate ourselves about addiction and recovery. We could look at what resources are available to them, but we could also look at what resources are available for us. Almost always, whatever resources are available for your loved one, there's something connected that's related to you. Whether it be outpatient, most of them have family education programs. If you're doing visitation at inpatient, sometimes they have family programs, family lectures, things like that you can attend. Open meetings, Al-Anon meetings. There's something for everybody. Maintain self-care and integrity. And when we talk about maintaining self-care, we also talk about setting boundaries. Boundaries are not selfish, although sometimes they seem selfish and it almost seems like we're doing something wrong. I think I struggle with boundaries just in general because I hate saying no. But someone told me no is a sentence. You just say no, period, no explanation. And that kind of stuck with me. But I know as a family member, setting boundaries was something that I kind of had to learn by trial and error. I would set them, I'd break them, I wouldn't maintain them, and I would see the consequence to doing so. Over time, I had to start to set boundaries, especially if I wanted to take care of myself. Because what do we know about control? We have no control over anybody else. We can only control ourselves and what we choose to do. Can't make anybody do anything. So control, we have to look at that when we're setting boundaries. What are we willing and not willing to do? What's best for me? What's best for them? Sometimes setting a boundary, we're not just setting it for ourselves, but we're also helping the other person. They just may not see it at the time. If they choose to get treatment or to, enter into recovery, usually they start to see what you see and they'll say, hey, I get it now. Maybe not then, but I get it now, and I'm glad that you did what you did. So we might not see those results immediately, but hopefully down the road we can end up on the same page. I thought there was more on there, but I guess not. So again, those are just some resources for you guys. We also have resources as far as treatment options, halfway houses, sober houses, things like that in the back. So please help yourself, or if they're not on your chair already, they're on your chair, so you can take them. We also have our website, LackawannaRecovery.org. So all of the resources that were available today, they're also on the website, as well as additional resources too. So that's something that you could check out anytime, any day. Thanks, guys.